enter the room.
Good morning, Dr. Zara Fu, GMC number 796-8868. May I proceed?
Yes.
Hello, good morning.
Good morning.
Hello, good morning. I'm one of the doctors here in the study. Could you please confirm me your full? I'm Dr. Zara Fu, one of the doctors here in the study. Could you please confirm me your full name?
My name is Emma Green.
Okay. So is it okay if I call you Emma? Hello?
Yes, you
Hello?
can call me Emma. Hello,
Okay.
can you hear me?
Yeah. So, Emma, I understand that you're here with your like person. Is she? Can you tell your relation to her?
Yeah, I bought my mother. Her name is Alice Green.
Yeah. Okay. Can you please confirm me your mother's age as well?
She's 80 years old.
Okay. So, and I understand, I can see from my notes that she underwent a fall. Am I right?
Yes.
Yes. So could you tell me a little bit more regarding it, how this happened?
I don't know. I was doing my work and all of a sudden I heard a bang sound.
Okay.
And I think, and then when I went to see her, I saw that she was on the floor. I think maybe she might have fell while she was using her Zimmer frame.
Okay. So, so when you saw her, what you saw? Was she lying on the floor? And yeah.
Yeah, she was on the floor.
Okay. So have you seen any kind of bleeding, any kind of like injury around her?
No,
And have you seen any a rolling of eyes or any discharge of urination or soiling of clothes?
no, doctor.
Okay. And was she conscious?
Mm,
Yeah.
I don't know, doctor. I mean, it
Uh,
happened all of a sudden, so I'm not
okay.
sure.
Okay. So what did you do afterwards?
Yeah, she just said that my mom said that she has some pain on the right side of her chest, and
Yeah.
so yeah, I just then brought her to the hospital to get
Okay.
checked.
Okay, so before that, before this incident happened, was she complaining of any headache or blurry vision or any other problem going on throughout the day?
No,
Okay, and have you noticed any unusual thing in his daily activities?
um, I mean, I'm her sole carer, so
Yeah.
I have a lot of responsibilities. I have to look towards my children. I also have to take care of my mother. So I'm the one who is helping my mother for her day-to-day activities.
Mm-hmm. So it must be very hard for you to see all the things, right?
Yes.
So would you able to take care of her? Because this will be doing alone so much task, won't be that easy, isn't it?
Yes, I know. Yeah, it is hard, but I still manage to do it.
Okay. Have you tried any help? Have you tried any, try to, hire some nursing care or something for her?
Um, I mean, it's I'm a single earning person in the family, and
Yeah,
as I've already told, I have a lot of
yeah.
work to do. So I don't want to send my mom to any sort of home care. I want to be her caregiver.
Yeah.
But yeah, I am open to have carers visiting home.
Okay. Okay. So, could you tell me that does she have any previous medical condition or illness going on that should I know of?
Yes, my mother has arthritis and hypertension.
Okay. And is she taking any kind of medications for it?
Yes, so for the hypertension, she's given amlodipine, and for the pain, she takes paracetamol.
Is she taking it regularly?
Yes,
Okay. And okay, so and like you, apart from you and your mother, who else lives in the home?
My two children.
Okay. So where you told me that you have so many duties, like, so when you're not at home, who looked after her?
No one.
Okay.
My kids
So
are there with her.
yeah. So okay. So actually, we are a little bit concerned regarding your mother as well, as you know, like during we did a chest X-ray, right? And although we didn't find any positive finding on chest X-ray, but we're concerned. We saw different bruises on her head. So like there are different colors. So we're concerned. Like, is there any specific reason that these bruises are there?
I don't know,
2
doctor.
minutes remaining.
I don't know what you're talking about.
Okay, so we have seen different kinds of bruises around your mother's arm, and they're of different colors. So we are concerned that, like, you know, as you told that she has only hypertension and osteoarthritis, no other disease, any clotting or bleeding disorder. So, like, why? And they're of different colors, not of specific color. So we're concerned that is something happening at, like in the home around, like.
I mean, yeah, okay. At times I might get a little impatient,
Yeah,
you know.
yeah.
Yeah, I
I can
don't feel good
understand that
about it.
sometimes. Yeah. Okay.
I have grabbed her at times because whenever, in the morning I have to leave for work at time. My employer expects me to be there
Mm.
on time. And
Yeah.
since sometimes, my mother takes a lot of time to get ready than expected, so I
Yeah.
might handle her roughly. Because there's so much going on. I have a lot in my plate. I have to be on I have to reach my work on time, but I'm not able to. But
Yeah.
so yeah, at times I do get a little rough on her,
So, you know, and
which I
like,
regret.
sometimes, yeah, I can understand. And, you know, sometimes, you know, like when we are dealing with, with the old age person, so sometimes it is very difficult for us to manage, no doubt. But, you know, like what we can do, like we can take some help when it's becoming difficult. And I know that if you're not managing and it's difficult for you to manage with the financial matters, so what there are many things like which where you don't need to pay, and they offer you like social services are there, and there are many communities who help them, and they can offer you the help at home as well, so you don't need to take that much
Move
burden
on
on
to the next
yourself.
station.
All right, thank you, Dr. Missy, and thank you, Dr. Zara, for that performance. All right, yeah, let's quickly look at the performance. Dr. Kamar, were you able to submit?
Should I do submit?
Yes, you have to click on submit, then it will
All
come
right.
on.
Yeah, okay. Is it
perform.
coming to you?
Have you submitted? Then once
Yes.
it refreshes, it comes into the page.
I've submitted now.
All right, let's take a look. All right, thank you so much, Doctor. All right, so let's take a look. So all the points that were covered well, which was confirm the full name and age of the patient. So in this case, the patient is the mother and the relationship with the daughter and her full name, right? Explore the incident. So once you're actually getting from, let's look at what the information that we're getting from the candidate information, right? So we have the fact that, this lady had a fall and was brought in by her daughter, right? And the nurse found bruises of different ages on her arm. And currently, she is undergoing an X-ray. So we don't really know about the X-ray results yet. All right. So understand what's actually written. So currently, she's undergoing the X-ray while you're talking to the doctor, right? So now, while talking to the daughter, you're trying to understand what is the incident that led her to the fall and any abuse that could potentially be there, right? So this is your task, all right, and address the concerns. All right, now let's take a look at the performance. All right, so good job on understanding the incident. right? So this is the part where you're supposed to get like a good idea of what has happened, right? So keep probing the information. Try to understand, the before history. Was she actually suffering from any condition? She mentioned that there was a Zimmer frame that she was using, right? And she mentioned that she witnessed the fall. So understand who all witnessed the fall, right? So she understands that she lives with this lady as well as her two kids. Was there anybody else present when the fall happened, right? Try to understand the incident history very well, because this is a case where you need to identify any risk factors and accordingly address it. So the incident history is of utmost importance here, right? So usually when it comes to these incident histories, their incident history changes as and when you keep asking questions. So you will see that there will be no inconsistent, there will be a lot of inconsistencies in what we have told and what they are recently telling, right? And they'll be very hesitant in talking to you, right? And so explore the incident history. Ask the daughter to describe what happened, what exactly happened when the fall occurred and who was present. Ask detailed questions about the fall time and how it happened, consciousness, witness, and previous falls. Explore medical history. Ask about any known conditions such as dementia, stroke, hypertension, or osteoporosis. Review current medication. Ask for a list of medication and specifically confirm usage of amlodipine and paracetamol. Right now, the main thing that would actually make understand a little bit more about whether or not it is an abuse. All right. So from this candid information, what is a piece of information that gives you an idea that it could be a patient who is at risk? In this entire candid information, which is that piece of information that gives you, the absolutely. So that is the information that you have to, ask in a way where she would, be revealing the real incident, right? So in the first time when you're asking about the incident history, she would be mentioning the incident that she would be fabricating, most probably, right? Which you will try to understand very well. And then you will present to her that on examination, the nurses notice that she's been having many bruises on her arm, and it doesn't look like they were recent. Were you aware of this? Could you tell me a little bit more about that? Open it up with an open question. Like, are you aware? Do you know about this? Do you know how this could have happened? Right? Stress on the fact that she is at home, you are the primary caregiver. Have you noticed anything? You know, you keep stressing on that fact, and and then if they still don't, open up, you can offer them to say that it's really important for us to understand, your mother's condition so that we can help her to the fullest. And especially, since she is an elderly woman, she is, people who are given special attention because they are at risk of being violated. So we would really need to understand this, from where this has happened, right? So, you're trying to put her on a spot where, you're trying to force it out of them. Like, this is very important for us to know. So then, they will also, either you can find out that, their history has been inconsistent, and you can actually mention it to them, that saying that at first you mentioned that you witnessed the fall, now you're mentioning that you were at work. Could you please explain that? Any inconsistency that you find, you have to bring that up. Right. So this is exactly how the station goes. So initially understand the incident history, bring that fact that helps you in understanding this is an abuse, and ask the incident history again so that you can understand any inconsistencies, right? And then put them on a spot, trying to understand that this is very important, especially since these are people who are at risk of abuse, and we will be doing further investigations to make sure such a thing is not happening, right? So that time she would be at a spot, and so that's when she will open up. All right. And then good job on asking about the financial history and the social history, because you're trying to understand what are the circumstances that are actually leading to this kind of a treatment, right? So explore the daughter's caregiving and responsibility, work situation and family dynamics. assess care dynamics and support system, explore who lives with the patient and the frequency of caregiver presence, the availability of additional support, right? So understand like what is their social associations like who all does this mother come into contact with? If there is any other potential abuser, you need to identify that, right? Is it the daughter who is abusing? What is her social circle like, right? So this is where you're actually getting a better idea of why this could be happening to this patient, because you've ruled out the other cause. Any medical cause you've actually ruled out, right? So she doesn't have any other medical condition. She's not taking any medication that could be, causing her to have these kind of a bruise, right? So you need to probe into other aspects where you can find clues of why this, where this abuse or these, bruises could happen from, right? Inquire and then finding the aspects that you missed. Inquire about the patient's mobility, cognitive status, and use of aid. Check fall history. Ask if the mother has had any previous fall, balance issues, or history of fracture. I think you've partially done this. You mentioned does she have any conditions that could cause her to fall, like any eye issues with her vision, or does she get dizzy or confused at times, right? Screen for elder abuse. Gently inquire about the source of the bruise and the care when the daughter is away. This is also something that you asked. Good job. So I'll actually put this in covered, because this is exactly what you asked. When you actually ask this question, that's when they'll actually start to open up, because this was the point. Even in the question itself, this is the point that actually gives you a hint that this patient is being abused. So you have to lead with that question when you're trying to make them open up, right? So good job on that. So I think data gathering checks out. I think I'll give you a 3 for data gathering. So good job on data gathering. So what happens once you actually understand that there is an underlying abuse to this patient, right? Explain the diagnosis and the situation. Explain that the fall needs careful evaluation to rule out injury and understand any other underlying causes, right? Explain the necessity of referring to social services and for suspected elder abuse, right? Normalize referral process, reassure the daughter that referral to social service is routine and meant to support both the patient and the caregiver, right? Because you've already understood the circumstances from which she's actually coming, right? Order relevant investigations. Recommend chest x-ray, CT scan, if any signs of head trauma, routine blood work if indicated, right? So now, since you actually know that this is like a non-accidental injury, you would actually want to do a full workup to understand, what is the extent of, what to say, consequences of the injuries that they have suffered, right? If there is any, if they have had any multiple head injuries, is there any kind of bleed that, could be ruled out? So, certain things have to be done. There'll be like an entire bone scan that would be done to understand, any likelihood of any other fractures, any malunions, right? So provide appropriate pain relief and care for the injury. So this is what you're going to be further doing. So understanding that this patient has been sustaining a lot of, what to say, injuries, what else would you be doing for her? You would be investigating and understanding, what is the extent of the injuries that she sustained. You would be giving her the appropriate care for all the injuries that she has been sustained, right? Explore long-term solutions like care visits and or considering a nursing home, right? Arrange a follow-up appointment if further action is needed. Provide a written information, give leaflets and pamphlets about elder care abuse and local care organization and respite services, right? And on top of that, one extra point is there that whenever you understand an abuse case, especially as an FY2, always involve your seniors. These are cases that you need to escalate to your seniors. So always, also whenever you understand that this is going to be a case of an abuse, always try to escalate to a senior, right? So whenever the social service is getting involved, that is the call that the senior makes. So mention senior always in these kind of cases, right? Awesome. And finally, we have interpersonal skills. Show empathy continuously towards both the patient and her daughter. Approach the topic of potential abuse with great sensitivity. Use clear, non-judgmental language when discussing the patient's condition and care options. Acknowledge and validate the daughter's emotions. I understand the situation is very stressful for you. I'm here to help. At no point you're actually blaming them, You're always supporting them. So always understand that this has happened, and these are the steps that we have to take since this has happened. And throughout this entire process, we will be supporting you and your mother, right? Provide continuous reassurance and support to daughter. Document all findings accurately for further reference, and ensure communication with the multidisciplinary team. All right.
To practice this case with AI, please visit TuringMedSchool.com.